Almost every single day in clinic, I'll speak to a patient who's had chest pain or breathlessness or chest discomfort or something that makes you wonder whether or not they may actually be having a heart attack. Whilst chest pain is the most common symptom people think of in relation to having a heart attack, there are several other symptoms. Sometimes a patient might actually present with just breathlessness or indigestion or pain in their shoulder or arm. It is important to be aware of some of the other symptoms that may present as a heart attack and therefore taking early action in order to get a better outcome for yourself. So come with me and let's talk about these in detail. Firstly, thank you to everyone who subscribed to this channel. I really appreciate you. I also know that a lot of you watch my videos but are not subscribed. So please subscribe if you're finding these videos helpful. And importantly, give it the thumbs up. It really helps the YouTube algorithm get this video out there to people who really need it. First of all, let's talk about what a heart attack is. So a heart attack is when the blood supply to the heart muscle itself is compromised. The heart is not the biggest muscle, but it is probably one of the most important muscles in the body. The heart is responsible for supplying oxygenated blood to the entire body, to all the important organs, the brain, the liver, the kidney, and our skeletal muscles. Some of that oxygenated blood also goes back to the heart, and the blood vessels that supply the heart are called your coronary arteries. If the blood flow within the coronary arteries is compromised in any way, usually by blood clots, this can lead to a heart attack. When there is a mild compromise, a partial blockage, patients will experience some chest pain that then gets better when they rest. It may come on when they exercise, but then gets better when they stop exercising. For example, when they're climbing stairs, walking uphill, or walking very fast or running, and when they stop, the pain goes away. Now, this is called angina. However, if there is a complete blockage of the coronary artery, this leads to a complete reduction of blood flow to the heart muscles, and if this isn't dealt with quickly enough, it will lead to death of the heart muscle. This is known as a heart attack. The good news is, if that coronary artery is opened up really quickly and blood flow resumes, you can actually revive the muscles of that area of the heart that the coronary artery was supplying. This is why it's really important that if you have symptoms of a heart attack, you seek urgent medical advice through emergency services. This is where you can get urgent help to see a cardiologist, a heart specialist doctor that can perform the procedure to rapidly open up that blood flow. The challenge for patients and even clinicians is that a lot of patients may not present with a chest pain at all, and we call these atypical symptoms of a heart attack. And I want you to be aware of what these atypical symptoms are so that you can seek advice early. If it's in the middle of the night, don't wait until the next day. Don't wait until it's morning. Go and get advice early if you're experiencing any of these symptoms. 1 in 2 patients, so about half of patients who are experiencing a heart attack, do not seek advice early. Moreover, about 1 in 3 patients who present with symptoms of a heart attack are initially wrongly diagnosed. So the challenge isn't just with patients, it is also with clinicians. But I want you to take control of your health, and if you're aware of these atypical symptoms, then you can seek prompt advice when it's necessary. The main reason why clinicians misdiagnose a heart attack is because of these atypical symptoms. The patient may not present with the typical chest pain. They may present with just breathlessness, indigestion. The patient might think they're getting heartburn, a bit of acid coming up the esophagus, just jaw pain, often the left side, but it can also be to the other side, shoulder pain or arm pain, sometimes bilateral arm pain, so pain in both your left and your right arm, and makes diagnosing a heart attack or even doing the test to see if someone has had a heart attack very difficult. But I want you to be aware, perhaps if you raise the possibility of whether you might be having a heart attack, it may also prompt your clinician to think about it and therefore do the necessary test. When someone is having a heart attack, it is important that the blocked coronary artery gets opened up as soon as possible. If this is done quickly, there is every chance that you can limit the damage to your heart muscles and even lead to recovery of the heart muscles. There are several coronary arteries, and our hearts are largely divided into the right side and the left side. The right side receiving blood that's been used up, so deoxygenated blood from the rest of the body. brings it in, takes it to the lungs, and it gets oxygen. And the lungs then send it to the left side of the heart and ready to go to the rest of the body, but also ready to go through the coronary arteries to supply the heart muscles themselves. And there are two main coronary arteries, one supplying the right side and one supplying the left side, and they have several branches. Where the blockage happens will determine how much of the heart is affected. So if the blockage happens quite high up, then a lot of the muscles that are supplied by the entire coronary artery on that side will get damaged. And this will result in a major heart attack and sometimes may even result in death. However, if the blockage happens in a smaller branch of the coronary artery, it may only be a small part of the heart that is affected. It will still present as chest pain or breathlessness or shoulder or jaw or arm pain, the typical symptoms that I mentioned. You will not know, neither will the clinician assessing you know which level of your coronary artery has been obstructed. This will only be found out when you're taken to the cardiac theatre and a cardiologist that performs a procedure called an angiogram. It's done by entering either through your radial artery in the wrist or your femoral arteries in the groin, and they can light up your coronary arteries and actually see whether the blood is flowing nicely or whether there are narrowings or obstructions or complete blockages. If a significant obstruction is found, they can insert stents, they can insert balloons that opens up and keeps the artery open, allowing a nice smooth flow of blood through that area of the coronary artery again. When you get to the accident and emergency department, or if you call an ambulance, they will perform an ECG when they suspect that someone might be having a heart attack. An ECG is an electrocardiogram, which is done by applying wires in various parts of your chest and your arms and legs, and this looks at the electrical activity of the heart. There is a normal pattern and there are typical patterns that are seen with heart attack. There's a specific pattern on an ECG called an ST elevation, where the ST segment of the ECG is elevated, which immediately indicates that someone is having a heart attack and will cause your attending doctor to speak to the cardiologist to rapidly get you into the cardiac theatre to do the angiogram and angioplasty, that is the ballooning or stenting of your coronary arteries. But there are some heart attacks that may actually show a completely normal looking ECG. So an ECG is one way of assessing whether someone is having a heart attack. The other way is by doing blood tests that look at chemicals released by the heart. And the most common one and most sensitive one and most specific one is called troponin blood test. If this blood test is raised above a certain level, it will indicate that someone has had a heart attack. So the question always is, should I see my GP first if I think I'm having a heart attack? Well, it is better to seek medical advice than not seek medical advice at all. However, if you think you're having a heart attack, it is really important you seek more emergency services. If you live close to an accident and emergency, perhaps go there or ask someone to drive you there. That may be a lot quicker. If you're in a lot of discomfort, it may actually be risky for you to try to take yourself to the accident and emergency in case you collapse or complication happens along the way. The other alternative is by calling the emergency services who will then dispatch an ambulance to see you, and in most cases paramedics will perform an ECG. If they think you're having a heart attack, they will direct you to the appropriate hospital where you can have a coronary angiogram. Waiting to see your GP if you think you're having a heart attack when you might not be able to get an appointment in a timely manner may actually cause a delay in you getting the treatment that you deserve. However, if you're not sure, by all means, call your general practice if it's during working hours. In England, we also have the NHS 111 service that you can call to ask for advice about your symptoms. The staff member that you speak to will go through your symptoms with you, and if they think you're having a heart attack, will either dispatch an ambulance to see you or ask you to go to the accident and emergency department if it's close by. It is so important to get the diagnosis right. Now, if the diagnosis of a heart attack is missed or significantly delayed, the mortality at 12 months, so the percentage of people who would be dead at 12 months is 21%. So that's 1 in 5 people approximately. If the diagnosis is correctly made the first time, the mortality at 12 months is down to 6 to 8%. It's a significant improvement. So it is really, really important that the diagnosis is got right the first time. And that is why it is important for you to know what these atypical symptoms are so that you can seek advice very early. So let's recap. A heart attack doesn't always present as chest pain. There are atypical symptoms including breathlessness, indigestion or heartburn, just pain in your jaw, shoulder or both arms. It is important for you to be aware of these atypical symptoms so that you can seek prompt advice. The sooner your heart attack is diagnosed, the sooner you can get specialist treatment, including opening up a blocked artery, which can save life, which can improve the quality of your life going forward. Now, if you'd like to know what you can do to reduce your risk of having a heart attack, please check out one of these other videos here or here on steps I can take to reduce my risk of having a heart attack. I wish you all the best on your journey towards being a master of your health, and I look forward to seeing you in our next video.